Okay, we're back for part 2 of BBLs. This topic in part 2 is under complications, and this is going to be a little more lengthy because complications is a big topic for BBLs, and this is where you're going to see all the numbers that roll in about the deaths. Thank you for those young men that have asked me to cover this topic. You asked for it, so let's continue discussing. I talked about a BBL in part 1, Brazilian butt lift, Miami thong lift, and skinny or mini BBL. BBL stands for Brazilian butt lift. All right, so with the complications, I'm going to go over just a few of them with you. Fat embolism, infection, liver laceration, sepsis, anemia, bowel and organ perforation, ischemic strokes, pulmonary emboli and cardiac events, hypovolemia. Why is a liver laceration happening, for example? Because the cannula used to aggressively go into the body in these areas to harvest out the fat before it gets processed and purified and goes back into the butt, perforations can occur. I don't know. I would love to talk with a plastic surgeon, somebody who specializes in this, and those that are doing liposuction procedures on a daily basis, so that you can explain why. Why is it that when we watch liposuction happening, it is such an aggressive, violent jamming in of, like, why jam the rod like that? Is that really necessary? Or maybe it is. I don't know. Okay, so the cannula can perforate the liver. The cannula can perforate other parts of the body too, such as the bowel. Major complications can set in when that happens. That can result in death and severe illness if that occurs. Here are the top 2 complications with a BBL, one of them being infection. The second one is the number 1 reason that deaths have occurred, and that has to do with a fat embolism. So what is a fat embolism? Well, after the fat has been suctioned out and purified, remember, it goes back in. That's what is forming the shape of the butt and the hips. And when it goes back in, what has been found is that instead of it being injected into the top part of the tissue of the buttocks, it's going down. And what happens is when this fat goes down into the buttocks muscle, there are large veins that are in this area. So imagine it going down in there and accidentally getting the fat injected straight into those veins. It used to be that the fat was injected into the muscles. And another reason too is if you have fat in this large buttocks muscle and swelling occurs and you're putting in a lot of volume of fat and fluid in there anyway, it's getting bigger, and then you have a lot of swelling, and there's tearing that can occur and injury to those large veins. So the fat can get in that way. When fat is inside the veins, it then can travel, and it can happen instantaneously or within a very short period of time, and the person then will pass away in the middle of surgery. I want to mention and just clarify that this is when the fat accidentally goes into the vein, right? So not the artery. It's not usually from the artery. If the fat enters an artery, it can cause localized tissue damage, for example, or necrosis. So that's not really a good thing either, but it doesn't lead to the classic pulmonary fat embolism that causes sudden death, like I mentioned, because it's like fat is blocking instantly into the pulmonary system, and you're not able to breathe. Can people survive a fat embolism? Yes, some people can, but the odds depend on the severity of it. Death can occur on the operating table or within minutes or a short period of time. I have read up on a couple people who have been on major life-saving measures in the ICU and on ECMO to save their life. So again, when that fat travels through the inferior vena cava in the buttocks area, right side of the heart, to the pulmonary arteries, where it then blocks flow to the lungs. So this is what causes a pulmonary fat embolism. In the first video, I talked a little bit about geography and that people do go to other countries. And that's what I want to talk about next. What's showing up in other countries? Is it any better there, any worse there? Why are people going there? And where in the United States have most of these complications and deaths occurred, and why? So the answer to that is South Florida. So the hub is Miami. That's where a lot are being done, but it's not because Miami itself is such a terrible place or the state of Florida is underregulated in general for all of their medical procedures. That's not the case. And as far as why people are fleeing to other countries to have all kinds of procedures done, from dental to tummy tucks to breast augmentation to life-saving cancer treatments and BBLs, has most to do with the cost. The cost is going to be maybe 1/4 or 1/3 or so of what the person might pay in the United States. But side note regarding cancer treatments, if you have friends that go there for their child's cancer treatment or their cancer treatment, or the story about the mom who brought her child to Mexico for treatment for chronic pain syndrome, it has to do with they don't find any relief that they feel in the United States, but they find people in other countries that are going to help them. Okay, so when all these complications and deaths have occurred here in the United States, in the Florida area, Florida years back developed a task force. The task force worked on cadavers, medical examiner was involved, they studied why and how this is occurring, that these men and women are dying from a BBL. Why and how can it be fixed? Well, I talked about it a little bit already about why, and that would be they're finding that the fat embolism is occurring because of the injection. The injection should be subcutaneous and be this direction, not deeply into the buttocks muscle where you have the large veins. So you don't want the fat to be in there, although that maybe was how it was many years back. The task force got together, but things got worse before they got better. Here are the two factors that have caused the deaths that the task force can pinpoint. The injection technique, how and where the fat is placed. So I already discussed that in detail. Number 2 would be the BBL surgeon, him or herself, and the facility factors. Who performs it and where? Surgeon training and credentials were found to not be happening for all of these surgeons. Do you guys remember reading about the person who did plastic surgery and gave a BBL on someone was a veterinarian? How about a pediatrician? That's another one too. So the pediatric provider is then doing this on the side to make money. Now remember, I said it's really important to recall how long this procedure takes. So on average, this procedure takes 2 to 4 hours. So we're going to say it takes a few hours. Surgery mills, budget clinics, they found that these doctors that were in there were not board certified plastic surgeons, and they are rotating through these clinics. The clinics themselves are not sanitary. They're in places that are kind of a pop-up clinic. They are manned by doctors who are doing 7, 8, 9 of these procedures a day. If you research the board certified physician in their high standard clinic, say in the United States, plastic surgery clinic, these doctors talk about doing 2 or 3 a day. That it's an exhausting and large endeavor to do a big surgery like this. So these rotating through doctors, as they found, were coming in through these surgery mills, as they call it in the literature, and pumping out 7, 8, 9 of them. They would start at 7 or 8 in the morning and be done at 10 o'clock at night. And one lady had her surgery at 8 p.m. Can you imagine being without water, without food, all the way up until 8 p.m., and you have somebody who's not board certified and thoroughly exhausted doing your procedure? The BBL surgeon himself or herself and the facility, like I said, are the second factor. So what's up with these facilities? It's not just the facilities that were performing the surgeries, but there were also major complications happening in the aftercare clinics that were not licensed and did not have licensed staff available to take care of these patients that just had major surgery. They didn't know how to take care of somebody properly with the proper medication, to know when an infection might be happening, to know when to call the surgeon. And again, they were people's houses. There even was surgery being performed in a doctor's home for BBLs. And then over here, another house that you're to go to that is manned by somebody's sister's cousin's wife who takes care of the produce, for example. Let's talk about how to reduce these complications. Number one, do your research. You have to find a clinic that, just like any surgery that you might have, but you want a doctor who is a board certified physician in the specialty that you are looking for. So if you're going to have heart surgery, it would be board certified cardiologist. If you want to have a BBL or you want to have plastic surgery, you want a board certified plastic surgeon. The facility itself should be accredited. What they put up in social media and on TikTok and the pictures that you see are not always the pictures that are of the facility. That's not really the inside of their facility, for example. Researching, finding a board certified plastic surgeon, an accredited clinic, and on your own research that this physician is board certified. Don't just take the information that you're seeing from social media or somewhere else that you're looking, Googling, and just take their word for it. It's your responsibility. It's like non-negotiable. You have to research and do reviews and look at the place yourself. I'm going to list below a place called certificationmatters.org, and there are many other places too, where you put your physician in. It will tell you if they're board certified and what they're board certified in. Once you verify the credentials and you found a clinic that you are considering, you then want to make an appointment face-to-face. I myself have even been at a plastic surgery clinic where I never saw the doctor, where my first encounter is with the sales lady who just talks over everything and hands you something upside down. You know, we've offered this and this and this, and which plan do you want? And then you get your date to show up and you talk about how you're going to pay. That's a red flag. You want your consultation to be with the surgeon that's going to be doing your procedure. Come with your list of questions. Ask a couple things. It's critical that you ask and talk about the subject of embolism, of fat embolism. Believe me, they're well aware of it. They know that the standard has changed, and the standard has changed that it's sub-Q. Remember, it's not this way. And the other thing I forgot to mention earlier is the standard has changed so that these physicians are supposed to be using ultrasound guided equipment in order to see better exactly where they're placing that cannula and then therefore placing that purified fat. Your beautiful body is not worth gambling your life. It's just not. And if people, they still are, if they're going to continue to go in and want a Brazilian butt lift, go to the best place that you can find. It is not just about the least expensive place that happens to be dirty and happens to be a dentist. For example, you want a board certified plastic surgeon in a facility that is accredited. What about their aftercare? Tell me about how a fat embolism is not going to happen. Make sure you hear the things like, we don't go into the muscle, and they need to explain the process to you, and they need to explain to you that they use guided enhanced ultrasound machines so that they don't go into the wrong place. Those are just some of the things that they should be talking with you about, as well as infection control and how do I get a hold of you afterwards? Where do you suggest I go for my healing? What's it going to feel like after I have this procedure done? Because it is very painful to recover. There is a lot involved in this major surgery and in healing. Now, everybody is different, and some people do better than others, and some people have major complications. And you want to know directly from your physician what to expect. Just like I talked about those surgery mills, those quick budget places, please think twice about going to those places. It's not worth it to risk your life for something that could kill you. It's just, I really weigh out the risks and benefits. That would really be, I can't, we can't tell people what to do, but considering all the things that I've talked about here and how to avoid the complications and to make sure that you avoid the high volume budget clinics, that is really critical. Be as healthy as you can be going into it. Make sure to contact your doctor immediately at any sign of complications, too much bleeding, infection, or pain that is not controlled. Now, you'd think that this would be self-explanatory, but women have died from mixing their medications that they're getting after their surgery, like, say, for example, oxycodone or some other narcotics, and it's getting mixed with things that are drugs that are not from the doctor. So if you go into it and you're mixing those things together, or you want to just self-treat and use the illicit drugs, think twice about that. Talk to your doctor about that. Okay, click above for part 3 of the BBL smell.